Helping you start your day with this anthem, This Is Me by Kiala Settle from the 2017 hit film The Greatest Showman. It's also one of those songs meant to help people fight through difficult times. And this morning, we're also playing this song in honor of those battling one of the most difficult forms of cancer, a type of brain cancer, glioblastoma. And today is Glioblastoma Awareness Day. And joining us to talk more about this disease and how you can support those fighting it is Dr. Jagannathan, president of Jagannathan Neurosurgery. Thank you so much for joining us this morning.
Thank you for having me.
First of all, let's talk a little bit about this type of cancer. For those who are not familiar with the effects and symptoms, tell us about glioblastoma.
Glioblastoma is one of the most common types of malignant brain cancers that we see. And it's a relatively rare tumor when you consider all tumors. The incidence is somewhere around 3 or 4 per 100,000 patients. But it tends to be a very deadly tumor because it tends to be highly invasive and it tends to grow very quickly. So the survival for glioblastoma, a lot of times when it's diagnosed, even with the advances in medicine or in surgery, is only about 12 to 15 months.
So how can people catch it early?
So typical signs for tumors like glioblastomas can be somewhat vague, and that's one of the problems with diagnosis. Oftentimes, patients will complain of headaches. Sometimes it can result in nausea or vomiting. Visual changes, double vision or blurry vision is not unusual. In severe cases, depending on the location, it can cause pressure on the brain that can result in weakness, in visual changes, and even things like seizures.
So are there a variety of treatment options for this that tend to work best?
As I was mentioning earlier, one of the problems with glioblastoma is that they tend to be very highly invasive tumors. And one study, for example, has demonstrated that even when a glioblastoma is found in one side of the brain, there can be cancerous cells that are seen in the spinal fluid or in other parts of the brain. So typically, the treatments that are recommended are a combination of radiation treatment with a form of chemotherapy. And that combination has been shown to extend survival. Other newer treatments have been looked at, things like using electromagnetic fields and types of immunotherapy, which may have promise. But at the moment, the fairly standard treatment is a combination of radiation and chemotherapy, along with surgery for debulking the tumor in many cases.
And typically, how old are the patients you're seeing who are battling this?
So usually you see two different spikes. Typically, the tumors can either come as what are called de novo tumors, which are tumors that arise out of nowhere. And typically in those cases, patients tend to be a little bit older, usually in their 60s or 70s. But the tumor can also come by alterations in more benign tumors or less malignant tumors that kind of gradually evolve into a glioblastoma. And typically that's seen in younger patients. And a lot of times that's a result of a genetic alteration or a genetic predisposition where these tumors that are not as malignant tend to spiral downhill towards the GBM. And when that happens, because it's more of a genetic predisposition, you see it in younger patients sometimes.
Obviously, folks are trying to raise awareness here by using the hashtag GBM Day. They're helping people also on Twitter. We have the information there on the screen as well as what they're doing on Facebook. And they can also go on Instagram. Thank you so much for being with us, Dr. Jagannathan, president of Jagannathan Neurosurgery. We really appreciate all you're doing to try to combat this disease.
Thank you for having me.
Absolutely.